Good morning, eye surgeons. Today we have a case of grade 2 nucleus sclerosis. So we are making the side port, first one, and this one is the second one. They are bang at the limbus, clear corneal incisions, two planar, and then we'll put viscoelastic 2% HPMC first on the cornea, just to have a clear view, then inside the anterior chamber, to stretch out the anterior capsule and maintain the AC during the CCC. So now without staining, I'm just doing the CCC with the help of 26 gauge cystitome. If your microscope is good, so you need not stain it in most of the cases except for hypermature or some other cases. So you can have a good control over rexes. Sometimes it might go little far, but you are able to retrieve it in one or two go. So the rexes is irregular, but it will do. So the main port incision is made. Followed by expression of little bit of anterior chamber viscoelastic, and then hydrodissection. You can see the fluid wave going posteriorly in all the quadrants. Followed by visco again to maintain the anterior chamber. Then rotation of the nucleus. This should be done gently and properly. Then we will do direct chop. We're going to do direct chop. We are doing direct chop, and with the help of ball chopper. First bearing of the nucleus, and then direct peripheral chop. Though the nucleus is soft, but I could lift the one of the pole. So in softer nucleus, it is better to lift the pole so as to avoid PCR. So after lifting the one pole of the soft nucleus, we can easily phaco it without worrying about the posterior capsule. The ball chopper is easy and friendly because we avoid keeping sharp instrument near to the posterior capsule, and mainly for softer cataracts this ball chopper becomes handy. So eating the nucleus piecemeal, chopping it all around in smaller pieces. Little bit of bubble is also there, so never mind. As long as the nuclear pieces are visible, we're not bothered about the bubbles. So after doing chopping, I'm just eating out all these phaco pieces, all these soft nuclear pieces. Here my parameters are not very high, because if even in softer cataracts, if a lot of chatter is there, and sometimes the nuclear pieces hit the endothelium, so post-op corneal edema will be there. So I try to keep the Phaco settings appropriate to the grade of cataract and the post-op corneal edema is less in most of our cases. So the last nuclear chunk, a lot of bubble trouble here. So after the last chunk, we'll shift to the Phaco 3 setting, that is power is 20, flow rate is 20, and vacuum is around 200. So even for the experienced surgeon, we have to be gentle and slow while doing these steps. You need not be in hurry because that will cause complications unnecessarily. So now the posterior plate is left. For the beginners, if you're not comfortable with, you should not be comfortable with Phaco 3 settings from day one. It will take some time for you to get adjusted to Phaco 3 settings for the posterior plate aspiration. So try to do it with irrigation aspiration only. And as you can see, the pupil is constricted in this patient, so you should dilate it with the help of either injection apitrate or phenogain, whatever is available with you. Once you're confident with your machine and your control over the machine, so you can go ahead with Phaco 3 for the posterior cortical plate. Little adjustment of the microscope, and then I'm trying with irrigation aspiration in this case, as the plate is very thinned out. I don't want to be in trouble while doing Phaco 3. As you can see, it is under your control. We can take out the whole plate piecemeal with the help of irrigation aspiration. Again, the fluctuation in the chamber should be minimized with the help of Phaco settings and instrumentation, because for the beginner, the instrumentation, the orientation of instrument is important. How to hold it, how to stabilize it, what to do, what not to do. For example, while doing irrigation aspiration, if you press the posterior lip or if your incision is leaky, you will have difficulty in even in irrigation aspiration and in every step for that matter. And if your incision is tight, you will be able to do all the steps easily and you will have control over the steps. So the incision making, the phaco to understand the machine parameters, everything is important, and it takes months to years to learn the phaco steps. It is not so like easy, or maybe you can say it is not a job of weeks, it takes months. Because every eye is different, every cataract is different, but basic remains same. So if you're meticulous in your steps, the chances of complication is less. You have to be cautious in each and every step, and everything should be under vision. Like at any point of time, there should not be defocus, or you're not able to see the capsule, you're not able to see the structures inside the eye. So, if your visibility is good, you will be able to do good surgery. You have to keep your eyes, ears, mind, everything open. You should have a good control over your foot, because if you have a good control over a period of time, then it is automatic. It becomes your muscle memory. Then there is no problem, there is no stress. But you need to understand the footstep of your machine, the sound, at which level you are. So as you can see, we are almost done. Few fibers are left. So now we are loading the hydrophobic intraocular lens, foldable one. So again, you should understand your IOL, how to load it. Every IOL is different, every injector cartridge system is different. So before deciding on to which IOL you want to put, you should be having thorough knowledge about the injector system. You should try some demos with unsterile ones, and then you can go through YouTube videos for the IOL injecting system and their techniques, and then you can go ahead during your cataract surgery. Because few injector system, they are not user friendly, kind of, they you will land up in complication because of injector system also. So you have to understand that each and every step, even the making of cystitome is important. There is a way of doing it. If you are like 1920, it is okay, but if there is gross difference between the standard one and your thing, then you will have a lot of problem in manipulating the instruments and doing these steps. So now we are implanting the lens. Thank you.